Stroke affects almost 800,000 people a year, and about 200,000 of those patients will have had a recurrent stroke. The risk of a stroke, once one has occurred, is about 5% per year. What we are really focused on is medication taking behavior, because we know that the best way to prevent a stroke once it's happened is to take medications that adjust or modify their risk factors, and lifestyle changes. So diet, exercise, and taking good care of yourself in general. All of those things are important for preventing another stroke from happening. In the AVAIL study, we specifically designed a large registry of stroke patients to assess medication taking behavior in patients who've had strokes. And this was one of the first registries of its kind, and also the largest registry of stroke patients outside of a clinical trial. So we had about 3,000 patients to start with, and then we followed them from discharge all the way to 12 months after the stroke. So some of the important findings from the 3-month data showed that patients who did not know how to refill their medications and did not know why they were taking their medications were strong predictors of stopping. We felt that was a very important piece of information that we could use for our real-world practice. Now, continuing with our follow-up, we have now the 12-month data for patients and what medications they're taking and what percent of their medications they're still taking. And what we found there is, of course, the percent of people who are still taking the same medications dropped. It went from 75% at 3 months to 66% at 12 months. We actually tried to remove the patients who had specifically said their physician or their provider stopped a medication. So what we're able to do now is look at the factors associated with patients discontinuing their medications. The key things from the patient perspective really is the number of medications they're on, having an adequate income, disability, so the more disabled someone is, the more likely they are to stop their medicine, having an appointment with a doctor, this is really important, taking their medications with the use of an aid such as a pill box, and having insurance, having instructions given to them at the time of discharge, so medication instructions, being married, and this is really important for having that social support to help with medications, and being discharged home. So all of those things are really important from the patient perspective. And I think the real-world message here is that with our health system, the more we can keep people covered with insurance and the social support to help them with their medications and making sure they have doctors, all of those things are probably going to have huge impacts on our ability to prevent strokes. As people live longer, they're more likely to have a stroke and live years before they might have their next one.